Hi, Dr. Jenna from Heart-Based Medicine, and this is the second part of my series on thyroid. So what I wanted to talk about was Hashimoto's. Now, Hashimoto's is an autoimmune disease. It is when the body, for some reason, and there's a multitude of reasons it can happen, decides that the thyroid doesn't belong there and start making antibodies against the thyroid. You can check that in a blood test and see if the antibodies are raised or not. Now, your antibodies can sometimes raise slightly, but it's when they raise quite a lot that you really have the true Hashimoto's thyroiditis. Now, with Hashimoto's, sometimes your thyroid can go high first and appear like it's Graves' disease or hyperthyroidism, and then fall. So you actually really need to check those antibodies to see, is it the high part of Hashimoto's before it goes into that low part of Hashimoto's. But most people with Hashimoto's have low thyroid, so the thyroid stops functioning. Now, most people that have been trained in Western medicine, like myself, we're not trained in how to treat Hashimoto's. We're trained in looking for it, but not in how to treat it. And actually, those naturopaths out there and homeopaths are much better at looking at Hashimoto's and treating Hashimoto's than most Western medical doctors are. If you can find a holistic medical doctor, then you're going to have someone that's going to help you and be on your side. So when you have Hashimoto's, like I said, that your body's making antibodies against the thyroid and attacking it. Now, sometimes you can catch Hashimoto's very early when it's just the antibodies have risen and the thyroid's still fine. And that's the time you really want to start treating it, because if you can get rid of those antibodies before they attack the thyroid too much, then you can cure Hashimoto's. Now, people say, can I cure my Hashimoto's? And my answer is, well, yes, sometimes, but not all the time. So if you get Hashimoto's early, and if you have an easy identifiable reason for Hashimoto's, then sometimes you can reverse it, and I have been able to reverse it in many patients. Other times, if it's been going on for a really long period of time, it's much harder to reverse. So I wouldn't 100% say, yes, all Hashimoto's is reversible, but a lot of it is, and I think it's worth a try. Now, what creates Hashimoto's? Now, again, that is a huge topic. So many things can create Hashimoto's or that autoimmune process. Probably the number one thing I would say out there is stress. And unfortunately, in our modern day society, we run on stress all the time. We're constantly running, we're pushing ourselves, we're drinking caffeine to keep ourselves going, we're running on that high cortisol state, and our thyroids just can't keep up with it. And the body sees the thyroid is wrong, and then it starts to attack it, which of course makes you more fatigued and more stressed. So it's kind of that terrible two-edged sword. Probably the other most common thing I see is hormone change in women. So you see a lot of women develop thyroid issues after having a baby or when they go into menopause. But even now, I'm starting to see it when girls go into menarche. I do see Hashimoto's run in families. I know they say that isn't the case, but I do see it. So I always keep a really close eye on children of women with Hashimoto's or family members that have a Hashimoto's, just to keep an eye on it. Because again, if you can catch it early, the better. Now, what else causes Hashimoto's? Toxins, endocrine disruptors in our environment. We have so many endocrine disruptors these days, and a lot of the foods we eat, a lot of the things we put on ourselves, a lot of the chemicals we use are endocrine disruptors. So the first thing I always say to somebody with Hashimoto's is get plastic out of your life. So that means not storing food in plastic, not cooking in plastic, not getting food wrapped in plastic. Again, that's almost impossible this day and age, but the more you can, the better. Trying not to buy a lot of canned foods, buying fresh foods, and buying organic foods as much as you can. Again, you also get plastics in a lot of your shampoos and conditioners. They have little microplastic in them to make your hair feel really silky and smooth. Your skin is a big absorptive surface. You're washing your hair, and then those run over your body and get absorbed. So you want to get onto a good organic shampoo, something without plastics in it. Then other endocrine disruptors, so many of them. Those little things you hang in your car to make your car smell good, anything that we use, air fresheners, a lot of our cleaning products, a lot of our skin products, our cosmetics, nail polish, hair dye, many, many things. So I also tell my Hashimoto's patients to try and clean up their lives as much as they can, get the toxins out of their life. Now, the other thing that can cause Hashimoto's is anything that causes leaky gut. Now, that can be food allergies, that can be IBS, that can be a number of different things. Excuse me. So again, working with a naturopath or a holistic GP to look at, are there some food issues for you? Are there some gut issues? Is your microbiome out of balance? Is that causing toxins in your life, which is causing the Hashimoto's? The last thing is heavy metals. We do get heavy metals a lot, unfortunately. A lot of things in our life get metals into us. We see arsenic in rice. We see lead in the soil if there's been batteries or cars around. We have a lot of aluminum or aluminium, depending on which country you live in, cooking in aluminum pans or aluminum foil. So many heavy metals. And again, your naturopath or holistic GP can do heavy metal testing for you to see if there's any issues. So when you have Hashimoto's, one of the things you want to do is uncover what the underlying cause is. And that is different testing, looking at when it started. It's a bit of a process to kind of come to that conclusion. The other thing that I like to do in someone with Hashimoto's is to keep their TSH below 2, because that keeps the antibodies, that'll bring the antibodies down and give your body a chance to really bring those antibodies down and to help heal the Hashimoto's. So again, as in the thyroid video I talked about, you can work with these different medications, with different herbs to try and help regulate that thyroid so it's not fighting so hard and fighting against itself. One caveat on iodine, I talked about iodine being really good for the thyroid. There's one time when I wouldn't give someone iodine, and that's when they have Hashimoto's and their TSH is high and their antibodies are really high. I don't want to stimulate the thyroid too much until we can start to bring the antibodies down. Again, that's a case by case, but in general, I don't usually use iodine straight up when I'm treating someone with Hashimoto's until I get that TSH down and get onto that root cause. So Hashimoto's is the leading cause of autoimmune disease in the world. The other thing when you're thinking about the thyroid gland is it is part of our endocrine system, but it's also part of our chakra system. So if you know anything about the body's chakras, this is the throat chakra or the 5th chakra. Thyroid illnesses can be related to things that are going on in that chakra as well. So the throat chakra is about expressing yourself, speaking your truth, but also being authentic. And you can see why for women that can be an issue, because a lot of women suppress themselves, don't speak up, play nice. So thyroid becomes an issue there. So when you have thyroid disease, it's also really important to work on those life balances. Again, stress is a big cause, but work on being your authentic self. Work with somebody in a spiritual way. Really work on yourself, on how you express yourself, on how you just present yourself. Are you speaking your truth or are you swallowing your truth? So I hope that was helpful. I'll talk to you again in the near future.